My name is William Shipman. I'm a PGY4 at Yale in the residency program there, and this work was done with my mentor, Dr. Jeffrey Dover. I have no disclosures. So hidradenitis suppurativa, or HS, is a chronic inflammatory condition that affects hair-bearing intertriginous areas, particularly the axilla, the groin, you can see it in the perineum, and also on the buttocks. It can be particularly painful for patients and can greatly affect their quality of life. The pathogenesis of HS is still incompletely understood, but over recent years, we have come to understand that follicular occlusion plays a key role in the pathogenesis of the disease due to keratinocyte proliferation that then results in follicular rupture, the development of inflammatory nodules and abscesses, and then subsequently you get the development of sinus tunnels and this chronic inflammatory response in the skin. Because the hair follicular unit plays such a key role in the pathogenesis of HS, laser hair removal, or laser hair reduction rather, has been used to treat HS in patients. In particular, long pulse ND-YAG laser has been one of the most extensively used modalities for laser hair removal in HS. In fact, according to the North American Clinical Guidelines for HS, long pulse ND-YAG is actually recommended for early stage 2 to 3 patients at a similar level of evidence as wide surgical excision and as some biologics, and is recommended in early stage 1 patients based on expert consensus. So although laser hair removal has been studied in HS, the efficacy and the appropriate laser modalities and settings and potential adverse effects are not still universally agreed upon in the dermatology community. So here we performed a systematic review and a meta-analysis of laser hair removal in the treatment of HS. We systematically reviewed the literature using predefined inclusion and exclusion criteria and included 10 studies in our systematic review. These 10 studies included randomized controlled trials, retrospective case series, some non-randomized studies, and they included 5 studies utilizing long pulse 1064 nanometer ND-YAG, 2 studies using long pulse alexandrite laser, 1 study using a light-based source in intense pulse light laser hair removal, 1 study using intralesional 1064 nanometer diode laser, and 1 study using a combination of combined fractional CO2 laser and long pulse 1064 nanometer ND-YAG. We performed a meta-analysis using 3 of those studies using long pulse ND-YAG laser and found a standardized mean difference of negative 1.68 in favor of laser hair removal in the treatment of HS, decreasing HS disease severity. So in conclusion, of the 10 studies that were included in this systematic review, in total it included 227 patients, and laser hair removal was shown to be effective in all included studies in reducing HS disease severity, regardless of what disease severity scoring method was used in the study and regardless of what laser hair removal modality was used. The meta-analysis that we did for the 3 studies demonstrated a standardized mean difference in HS-LASI, which is a specific HS disease severity scoring system, of negative 1.68 in favor of laser hair removal. There were minimal adverse effects shown in the studies, and it primarily consisted of transient pain and erythema that resolved pretty rapidly. So given these findings, laser hair removal should be considered for HS patients, at least as a potential adjuvant treatment. Laser hair removal has potential adverse effects, particularly dyspigmentation for darker skin types. However, several of our studies included patients with Fitzpatrick skin types 4 to 6, and these studies also demonstrated efficacy and minimal adverse effects, even in these more heavily pigmented patients. Notably, dyspigmentation was not reported in any of these included studies. The ND-YAG laser has a longer wavelength and minimal unintentional damage to the pigmented epidermis, so this should be strongly considered for laser hair removal in HS patients with more heavily pigmented skin. However, other laser hair removal modalities should also be considered if no other options are available, because we also have to keep in mind HS disease itself is going to cause dyspigmentation and severe scarring and pain in the patient. So if you do have an alexandrite laser, you may consider using that also. It's known that combined biologic and surgical treatments in HS demonstrates greater clinical effectiveness and quality of life compared to biologic monotherapy. So whether combined medical and laser hair removal or medical surgical and laser hair removal treatment is synergistic is unknown, but it is likely. We also believe that early treatment with laser hair removal during the pre-puberty stage or at the onset of pubarchy or shortly after pubarchy may prevent HS development in patients that have a strong family history or other risk factors. And we think laser hair removal may be an effective early HS treatment that will prevent progression to late-stage disease and subsequent development of sinus tunnels, which, as we know, are very challenging to treat. The last point I want to make is that insurance coverage for laser hair removal is very challenging. However, laser hair removal may be more cost-effective than biologic or surgical interventions. Compared to the FDA-approved biologic therapies that we have that can be upwards of $16,000 to $18,000 per year, laser hair removal could be more cost-effective and possibly a more durable solution for our patients. So with that, thank you for your attention.